A pleasant day and a very warm welcome to your favorite medical discussion, IMED. So ladies and gentlemen, you are a person who are watching television. That's why you come into contact with these types of programs, or rather the uploaded version of a YouTube program. So what is the purpose of watching a program? What is the purpose of watching news? What is the purpose of reading something? You must get to know, and you are eager and you need to quench the thirst of knowledge, or to entertain yourself, or there are many perspectives and having those types of exposures. So learning about disease conditions is not limited to physicians, but as ordinary people who are the victims of those disease conditions, they must get to know, and that is a must to get some sort of a knowledge. What are the types of diseases that we can have, that we can deal with, and what are the types of diseases that other people are engaged with. So for ourselves, we can give our own advices, and for other people, we can exercise due care and not to let them down in the society. So to discuss one of the most important areas in IMED, we have invited Dr. Gamini Pathirana, consultant neurologist of National Hospital of Sri Lanka. So thank you very much, sir, for accepting our invitation and doing the honors with regard to today's program. So when it comes to disease conditions, there are many. Diseases are numberless. That means there are many types of diseases. And today also for IMED, we are focusing about one of the small specific disease, which is a neurological disease, might be like Parkinson's disease. So what is Parkinson's disease?
Thank you, Charita, for inviting me to talk in this ChannelEye. Okay, Parkinson's disease actually is a disease of elderly. It's a neurological problem which is belonging to the category called degenerative neurological disorders, and it's a progressive disease. Now, we all know Parkinson's disease as it belongs to a special category called movement disorders, which is a branch of neurology. And in fact, initial presentation where we diagnose a patient having Parkinson's disease is by four things.
Right.
One is tremor. Tremor means shivering, to and fro movement of a part of the body, and which is a rhythmic movement. And then you will have stiffness or rigidity. In medicine, we call it rigidity. The difficulty in moving across the joints. There is so much of tension and stiffness. And the third thing is the postural instability. You will be having loss of balance. So tremor, rigidity, and we also call it bradykinesia, slowness. We can do tasks at a particular speed, and these patients develop slowness in doing things.
Right.
There are certain tasks during daytime that we need fast actions, like say if you are brushing your teeth, for example. So such things find it difficult, and this Parkinson's disease is this syndrome what I described is called Parkinsonism, and this can happen due to many causes. The most common reason why you get this is called idiopathic Parkinson's disease, which is a degenerative problem where people initially develops tremor, the shiveriness, which is actually happening at rest. When you are not doing anything, you start shivering. When you try to do a particular task, the tremor disappears. So in fact, Parkinsonian tremor, we say it's a non-disabling tremor. It doesn't disable a person, because the moment you start doing something, the tremor disappears.
Right.
And the slowness of movement is a major symptom in Parkinson's disease. Slowness means your walking is slow, every action becomes slow. And when you're writing, your writing also become very small text, and when you try to look at their faces, they don't have much emotions. In medicine, people used to call mask-like face. So this slowness and tremor is the two most important symptoms in Parkinson's disease. But having said that, this is not the starting symptom.
Right.
If you ask from a patient who is having symptoms of Parkinson's disease, did you ever have any other symptom? Most of them say, I was having loss of smell for a number of years. I was constipated for a number of years. I had sleep disturbances for a number of years. But these symptoms, this loss of smell or constipation and sleep disturbance, they are very common. No one will be able to diagnose them as Parkinson's disease. So you wonder whether this disease cannot be diagnosed in the very early stage. These non-motor symptoms, we call it pre-motor phase of the problem. In fact, these patients are not diagnosed at that stage.
Right.
And whenever you are getting a disease, people always think I should have been diagnosed very early. People think if you diagnose very early, maybe we can cure it. Unfortunately, Parkinson disease occurs due to deposition of a chemical in the brain cells.
Right.
This chemical is called alpha-synuclein, and this deposits initially in the there's a thing called brain stem.
Yes.
So in one of the area called substantia nigra, this deposition is taking place. And you may be aware our brain has a lot of circuits.
Yes.
They are full of wires, a trillion neurons. They are connected to each other through a space called synapse. And whenever one neuron talks to the next neuron, there should be a chemical in between.
Yes.
To get the information propagated to the next nerve cell, it is transmitted to the next nerve cell in between this space by a chemical.
Yes.
And there are many chemicals within these synapses. One of the important chemicals is called dopamine. So dopamine using networks or circuits getting dysfunctional.
Right.
So people used to say it's a probably deficiency of dopamine which is causing this. It's true. Dopamine using neural network, which is, there's a name for it, but I don't want to say that. So that's the root cause of this.
Right. So when it comes to explanation of Parkinson's disease, so doctor explained you very clearly the activities behind the body that we can't see. What are the changes? You might be some with unfamiliar with, like Parkinsonism, the tremor, the resting tremor when it disappears, and the brain stem, and some synapses, some chemicals, dopamine, and likewise those things like medical terms. Yes, they are a bit difficult to understand, but doctor explained you very clearly the messaging mechanism. This is the place where the message comes, and to the next there should be a transporter, that is the chemical, and that is the pathology behind this disease. Because these diseases, sometimes there are no causes being idiopathic, and sometimes there are certain conditions, as doctor explained you, because when it comes to these types of diseases, you might be having certain other causes for a long period of time. This is not the onset. Likewise, this is a complex disease. So it's not been diagnosed in the initial stage, because as doctor said, these common clinical features, or rather the constipation and certain these conditions related with the movements, there are certain conditions that is ordinarily dealt with. Now you are not confining them as certain symptoms of such types of a disease. And so when it comes to that particular explanation, people might think, yes, I'm having constipation, and yes, doctor said some of the symptoms, smell sensation is reduced, even the perfume my sister is using, I can't smell that properly, might be the Parkinson's disease. Is that so, sir?
Good question, Charita. If you are not having smell these days, one of the reasons people don't have smelling things is this is actually COVID. People who get COVID, they lose ability to smell things, and also some people, after being relieved from COVID, they have that symptom going on for some time. But loss of smell sensation, in medical terms we call it anosmia, could be a symptom that is pre-existing before developing Parkinson's disease. If I am having anosmia or loss of smell sensation now, does it mean that I am likely to develop Parkinson's disease in the future? We don't know. Not everyone who is having anosmia will develop Parkinson's disease.
Yes.
We don't say you are going to develop it, but maybe you are. We don't know. Maybe you are going to develop that, but we don't want to know whether I am going to develop Parkinson's disease right now, because few reasons. Parkinson's disease, the root problem, a deposition of alpha-synuclein in the brain cells. We have no control over getting rid of this root problem.
Right.
We have treatments, very good treatment for relieving the symptoms, but we have no control over the root cause. So knowing early whether we can get rid of this disease, whether we can cure it, is not a question about Parkinson's disease. We have no control over that. But researchers, they are looking for various ways of diagnosing Parkinson's disease at the early stage, because they are looking for a cure. If you want to look for a cure, you must diagnose them very early and then attempt to give various treatment trials and then try to find a cure. But for our purposes, for patients' purposes, if there is no cure, if you try to control symptoms only, why do you want to know it very early? Probably not necessary. In fact, Parkinson's disease initial classic symptoms are late.
Right.
Before that you will have many symptoms as I described. These are called pre-motor symptoms like constipation and anosmia, which is loss of smell sensation, and also sleep disturbances. I want to tell you a word about sleep disturbances. It could be inability to sleep, it could be hyper, you'll be more sleepy, and also normally we go to the bed in the night to sleep, and then you wake up in the morning, you are not aware what's going on. But during this sleep, you go into various stages.
Right.
There are various phases that you go into, and there are a couple of phases happening during the sleep until you wake up. They are called, there's a period of sleep called REM sleep, REM.
Right.
REM stands for rapid eye movement. If you watch a dog sleeping, sometimes you see against a closed eye you see eye movements taking place inside.
Yeah.
That's the rapid eye movement phase of your sleep.
Right.
If you look at a child, very small child who is sleeping, sometimes you see they will rapidly moving eyes underneath the eyelids. That's the REM phase of the sleep.
Right.
During this REM phase, normally that's the phase you dream. REM sleep phase is where you normally dream.
Right.
But during this phase, you cannot move. Your body is completely paralyzed. You can dream many things, but you will not act. You can't do any movements. But in Parkinsonian syndromes, during the REM phase, some patients do not have this paralysis component during the REM phase. What happens is you dream, and this loss of tone, the movements can be done during that phase in Parkinson patients. So you act your dreams. Most of the time, bed partners are brought to hospital saying, this fellow is kicking me in the night. And sometimes some people start getting out of the bed and walk.
Right.
Various things. They keep talking, and sometimes they go to the kitchen and prepare meals. Various things are happening during sleep. This is a dangerous situation. You can injure yourself.
Right.
There are some other reasons, some other symptoms that they have before, or sometimes after diagnosing Parkinson's disease. So diagnosing early is not a major question.
Right.
And who is the best person to diagnose Parkinson's disease?
Yes.
Now, in other countries, there's a subspecialty from neurology called movement disorder specialist,
Right.
which is not existing in our country. We have neurologists only, but some of the neurologists are, having some interest in seeing movement disorders. But you become a specialist in a particular field when you start seeing that patients only and nothing else.
Right.
So if I'm a movement disorder specialist, I should be seeing movement disorders only. If I'm seeing everything, then I'm a neurologist with a special interest. In movement disease. And other countries, sometimes they have movement disorder specialists. But in Sri Lanka, we have neurologists looking after Parkinson's disease. So best person would be a movement disorder specialist, and second best would be a neurologist to diagnose Parkinson's disease. Sometimes they also miss in the early phase. So there is a diagnostic delay in Parkinson's disease in most of them.
Right. Okay, so you are clear with this explanation. There will be a diagnostic delay because the symptoms of the disease might not be manifested in the proper time. That is not a defect while you are having with doctors, but during these research studies they are going to implement, they are going to find new facts, and later in certain years they might be developing certain causes and certain treatments even for the onset of the initial conditions. So for the moment, under the research studies and the knowledge that they have assimilated, there is a consistent or rather a considerable delay in diagnosing Parkinson's disease. And so for example, now I'm going to a different aspect. So you said that there is a diagnostic delay. Sometimes there are certain diseases, for example, high blood sugar, diabetes conditions, diabetes mellitus. So in certain cases, it's been silent for a certain year, no symptoms are manifested, but like with the excessive urination or something like that, the people feel some discomfort, and sometimes they even doesn't know that, they even go to just it's better to check a fasting blood sugar. Oh, right, when the reports are coming, it's more than 180. So sometimes they check to the next one, glycosylated hemoglobin HbA1c, then all right, it's been like somewhere around 7 point higher, right? They only diagnose at that moment. Likewise, what is the specific stage where these Parkinson's patients are diagnosed?
Yeah, now with regard to diabetes, actually we want to diagnose them very early, because the longer you are with diabetes, the higher the chance of having complications associated with diabetes. But for Parkinson's disease, by diagnosing very early or late, doesn't going to make a big difference.
Right.
Because whatever the stage you are diagnosed, what doctors does is to get rid of your symptoms. Most patients with Parkinson's disease, they are rigid and they cannot move. Some of them are chair bound, some of them are bed bound. In fact, this disease had been there for a number of centuries.
Right.
Now, initial description coming from James Parkinson about 200 years ago. That's the time people, he initially submitted a paper called shaking palsy.
Right.
Because these Parkinson disease symptoms are asymmetric. They have more symptoms on one side than the other.
Right.
Your tremor or shiveriness is more on one side than the other. And your difficulty moving also is one side worse than the other side. And when you don't have much tremor, people tend to think this is maybe a stroke. Because right side is not moving. The stroke causes defect only on one side.
Right.
So some patients who are coming to me with Parkinsonian symptoms, they carry a diagnosis card earlier by someone else saying this is a stroke, and they are on drugs for stroke treatment.
Right.
So now the initial description coming 200 years ago, and then we didn't have a treatment for it. In 1960s, a guy by the name Carlson who found the cure for this. He was able to replace the lost dopamine, which is the chemical which is deficient in the brain,
Right.
as outside tablet. And the moment you start this replacement of this chemical, you will give it as a tablet, they start working. And that's a big difference for the patient. So that is the most effective treatment up to now. There have been so many other advances taken place over the last couple of decades, but dopamine replacement is the most important, most effective treatment available even now. So Carlson won the Nobel Prize for this particular discovery, and patients who have been chair bound and bed bound started walking after this discovery. And though dopamine is a symptom reliever, for patients feel I'm cured. He got rid of all the symptoms, and it's a big difference for the patient. Right. So on the other hand, when someone is immobile, when someone is on the chair or bed 24/7, they develop other problems because of the immobility, not because of the disease. So those problems are prevented by giving this chemical. In other words, their life expectancy improved after this discovery. So this drug is available for our patients, and this is what we have been treating with.
Right.
Now, Parkinson's pathology, the root cause within the nerve cells, is not being addressed. We are not treating for that. That particular problem in the brain cells is progressive. So you will need more and more dopamine as the time goes on. And after, I'm talking about number of years, so maybe 3-4 years later, you will see that you need dopamine replacement more frequently.
Right.
In the initial phase, you were giving maybe twice a day, for example, but as the disease advances, you need to give them maybe every 3 hours, every 4 hours, or maybe every 2 hours, something like that.
Right.
You need frequent and continuous supply of dopamine.
Right. So with that explanation, you might have a clear understanding. In a certain time period, there were no cure. The patients were bedbound and they were not able to move, but with the replacement of that defect with a certain tablet, now patients start walking. They got relieved of certain symptoms, but not the root cause. So with that explanation, you might be clear what this type of a disease is and how it's been progressed, the progressiveness of the disease being used to increase the dose of the tablet, and there are certain conditions. And so there's another thing that we have to clarify. You said that movement disorders, that means difficulty in moving. For example, now I'm just staying like this, and most frequently I'm not moving my hand. It's always like this. So I'm not using this hand. Like without using, it's not been flexed or extends, like moved in and out. So it's like stuck to a certain position, and because I'm not using, they have a certain type of a stiffness. Will that cause some sort of a condition which lead to the nervous system? Because people might think that, right, so this disease have these types of symptoms. If I create these types of symptoms, will it affect the disease? Is there any such condition?
The answer is no. Whether you are going to develop Parkinson disease is not dependent on what you do.
Right.
Well, this is a genetic, there's genetic predisposition for some people to develop Parkinson's disease. Can it be familial? Does it go in the family? When my father is affected, does it mean that I'm going to get affected? Most often, no. Very rarely we see familial Parkinson disease, but most often they're sporadic and they are coming from here and there. But always there's a genetic predisposition. So there in the genes, in the coding system, it's written you are likely to get this disease. But not all of them going to get disease because there is a environmental factors also playing on it.
Right.
So what environmental factors actually specifically doing this, we are not fully understanding. But we know Parkinson disease happens to some individuals here and there as they grow older. And can we prevent getting this? If I am destined to get this, if it is in the coding system that I am likely to develop this, can I prevent it? Can I post date this? Starting at least if I can delay? Yes, you may do that. You can, if you are destined to develop a neurological illness as you grow older, whatever the neurological illness, whether it's dementia, Parkinson disease or whatever, you can post date the onset of this neurological disease by following good lifestyle. What is good lifestyle? It's the same thing that cardiologists advise to prevent heart attacks.
Yes.
It's the same thing that neurologists advise to prevent strokes. You have 10 factors to look after.
Yes.
One is your how much exercise you do, and what is your food that you eat, and how stress free you are, and you are a non-smoker or you're free of alcohol, and your body weight, and your diabetes, whether you are controlling your blood sugar levels, your all this blood sugar, high blood pressure and cholesterol, whether you are keeping them under control, all these factors will post date your onset of Parkinson disease. So pay attention to those, then you can post date the onset, or you can delay the onset of whatever the neurological problems that you are likely to get as you grow older.
Right. So as a consultant, the doctor gave certain specific advices. There are certain factors which will trigger certain conditions. So likewise, there are many disease conditions related with lack of exercises. If you are not controlling your blood sugar level, if you are performing a certain diet with high calorie, high sugar and certain with oils and all those things, you might be getting certain worse disease conditions, so cholesterol, strokes and so on and so forth. So like a neurological disorder can be post-dated. You can just put it into somewhere around 1, 2, 3 or 5. Sometimes they might not get such a disease when they lead good lifestyle. Yes. So in that case, we are just familiar with a good lifestyle. If you can maintain a good lifestyle, as doctor explained you, that will be a better preventive mechanism to these types of progressive, in a sense, like you can't avoid these things sometimes, or rather it will become worsen by the time lapsing thing, and like those things we can control. And so at last I would like to enlighten a small thing. What is the speech difficulty or something related with Parkinson's disease?
Yeah, because of slowness which affects the whole body, you will not be able to talk loud. Your voice becomes softer, and sometimes the words, the pronunciation also not very clear sometimes. And as you grow older, so you have to very carefully listen to them and understand what's going on. You're not going to encounter loss of speech in Parkinson disease. Your speech will remain, but it becomes in medicine we say it's the amplitude is slow. We will not be loud enough, and you are not fast enough also. You'll be talking very slowly.
Right. Okay. So that is the speech thing that we must enlighten in this context. So we have done several programs about neurological disorder, but this program is quite different. We just came deep into the factors that you are dealing with, more onto symptoms and more onto some sort of realistic conditions that people deal with, and the current trends in the scientific research and how they can manage, and the treatment management and those aspects with regard to treatments. We went in deep to those things. So thank you very much, sir. Dr. Gamini Pathirana, consultant neurologist of National Hospital of Sri Lanka and honorary lecturer to the Faculty of Medicine, University of Colombo, to join the honors with this Parkinson's disease. So ladies and gentlemen, with iMed program, you're having a lot of exposure to many disease conditions. So stay tuned with iMed. You'll be getting ample of knowledge with regard to your health and well-being. Thank you very much for watching. Have a pleasant day.